So Ronnie sprained his ankle on a gopher hole about 2 days ago, and he still has some bruising and swelling in the area. So he's gonna still be in the inflammatory phase. And so some of the indications that he has for using ultrasound is that he has that sprained ankle. So we're gonna wanna use ultrasound so we can get some more fibroblast activity to lay down more collagen in that area. And some of the contraindications and precautions that we're going to want to look at with him is that he does have a pacemaker. Since that's going to be more of an issue if we were working up near the heart or up near the cervical spine in that area, it's probably not going to be too bad of an issue. Another thing that we want to pay attention to is that he has type 2 diabetes and he's had it for 5 years. So we're going to want to be careful of any diabetic neuropathies, and we want to make sure that there's proper blood flow as well as sensation to that area. All right, how you doing today, Ronnie?
I'm doing okay.
Good, glad to hear it. So my name's Colton. I'm going to be your student physical therapist. I want to make sure it's your left ankle that's been having issues. I heard you stepped in a gopher hole. Is that correct?
Yep.
Gee, sorry to hear about that. When was it that this happened?
Just a couple days ago.
Just a couple days ago?
Mm-hmm.
Okay. And then I was looking through your chart, and there was a couple things that we saw that you were diabetic, so we're going to make sure that you have sensation in your foot. Do you have any diabetic neuropathy that you're aware of?
Not that I know of.
Any decreased sensation in your foot that you know? Okay. So what I'm going to have you do is I'm going to have you lay down on the table. So lay down on your back for me. Okay. Is that comfortable for you?
Yeah.
Perfect. And then what I'm going to be doing is using this ultrasound machine. Have you had ultrasound done on you before, or is this the first time?
This is the first time.
Okay, good to hear it. So the reason that we're going to be doing this is because ultrasound has been shown to be able to increase. You tore your ligament, correct? That's what the doctor told you. So the ligament is actually made of what's called collagen fiber. I don't know, are you familiar with that?
No, I'm not.
Okay, so what this ultrasound is going to do is it's going to help your body to just create more of that ligament collagen fiber. So that's why I want to be able to use this treatment on you. Is that something you feel comfortable with?
Yeah, that's okay.
Okay, awesome. So what we're going to do is we're going to get this set up for you. So I'm just going to hit the sound, and then we're going to, since it's not a very deep structure, we're going to set it to 3 megahertz, and since we don't want any thermal because he's in the inflammation phase, I'm going to set it to a 50% duty cycle. The intensity, we can put it from 0.5 to 1. I'm going to crank it up to 1, and then we're going to do this for about 5 minutes. And then what we want to make sure is when we're using the ERA that it's about 2 to 3 times the size of the ERA, so about 3/4 of this head, okay? So we're not going to be going over like a big area. We're just going to be going over just a little bit of your ankle, really where it's hurting the most, okay? But before I get started on that, we want to make sure that we check your sensation, okay? I know you said that you haven't really had issues with it. We just want to double check though. Okay, it looks like you have some bruising here and some swelling still. So that's why we're not going to be putting it on any thermal heat, okay?
Okay.
And so what it's just going to feel like is just this gel and then like a cold metal is going to be on you, okay? But let me know if you feel this. Does that hurt?
A little bit.
A little bit, you can feel that? Okay,
Yeah.
how about up here?
Not as bad up there.
Okay, but you can feel it, right?
Mm-hmm.
Okay, how about down here?
Yeah, I can feel that.
Okay, and then you don't have any problems with poor blood circulation in your feet that you're aware of, do you?
No.
Okay, awesome. So it sounds like you're gonna do really well with this. I'm just gonna put this gel on here. Guess we're running a little bit low. All right, just enough for you.
Perfect.
Perfect, and then I'm gonna put this on. Then I'm gonna go ahead and start it. How's that feeling?
Feels okay. Nice and cold.
A little cold, like I told you, huh? Okay, so you shouldn't be feeling any pain or any heat that's going on. You're not feeling any of that, correct?
Nope.
Okay, let me know if you do, okay? Because we want to make sure we keep you safe. Perfect. So time's up. I'm gonna clean this off and then clean off your foot for you. Lift your foot just a little bit. I want to be careful with this. Any pain with that?
No.
Okay. Make sure you got all this gel off you. All right, how did you feel during that?
Felt okay.
Okay. And how is it feeling now?
Feels good.
Okay, good. Glad to hear it. So now that we have this done, we have you prepped. It looks like there obviously isn't any burning, but you still have some of that swelling. Okay. So we're going to be careful, but we're going to get you going on some other exercises and other modalities. Okay.
Okay.
Sounds good.